Hi, my name is Brooke Taylor. I am doing a presentation on rural healthcare access in America as a part of NSC 842 at Eastern Kentucky University, instructed by Dr. Nancy G. Owens. Access to healthcare in rural America is of course limited by distance. These people are living further away from the services they need, including primary care, hospitals, specialty services, and they may have further difficulty getting access to home health services. Even things that we use to make healthcare more accessible, like virtual health services, may be limited due to issues with internet service providers and cost. One key issue when examining rural healthcare is that federal agencies have no clear definition of what rural means. The CDC estimates that nearly 76 million people live in rural areas in the US, while the USDA says almost 7 million live in the US, which is a massive gap, and the people living in between these lines may not be getting adequate access to healthcare. In the 2019 to 2021 National Healthcare Survey, rural areas and rural Americans were rated to have lower healthcare affordability than urban counterparts. People in Montana and providers in a Montana survey showed that distance to services, fewer available resources such as hospital beds and providers, failure of Western medicine to work alongside the practices of minority groups, including Native Americans and Hispanic populations in the area, and the tough, can-do, stubborn attitude of rural Americans that really would rather tough it out than seek healthcare in cases where they feel they're able. The pursuit of profit over patient care by healthcare organizations was another pinpointed objective that needed to be targeted in order for the providers of Montana to feel their healthcare would be more adequate. In order to improve the quality of healthcare for rural Americans, we need to see legislative changes on a larger level in this country in order to make healthcare more affordable for everyone and improve existing healthcare systems. The quality and availability of virtual healthcare and the internet must continue to be improved, especially for rural Americans. Educational bodies should improve education for providers on the limitations of healthcare in rural areas, for new providers that are receiving ongoing education now, as well as for existing providers. Individual providers can make a difference by offering hours to accommodate blue-collar workers that would be after usual business and work hours, such as Saturdays or even staying till like 6:30 in the evening to allow for people who are working to still seek the care they need. Education on mental health should be provided by primary care providers in rural areas, and screening should also be conducted in the offices so that people who need the specialty services can receive them. In conclusion, those who live in rural America often love the places that they live and really wouldn't plan to change that. However, they do deserve access to equal levels of healthcare for those of urban populations in all other areas. Rural living has many benefits to those who partake in it, and the secluded lifestyle can also have its own health benefits, but it can negatively impact the patient's ability to have access to the health care they need. Technological advancements increase education for providers, and changes to the system are needed to reduce healthcare costs and improve access for rural residents and all Americans. One question we can look at to further discuss rural healthcare in America is what interventions to expand healthcare access in rural settings have already been tried and tested in our local communities. Look at the success of those, and if they did not work, why? A second point of discussion is what additional factors previously unaddressed could contribute to subpar healthcare in rural areas. The references are included in the final slide as follows. Thank you so much for watching my presentation, and I look forward to further discussion.